Hey, what's up guys? My name is Kelly Troutman. I am a certified hand therapist, and in today's video I am going to show you two different ways for removing, let's just mess up the whole intro, it's fine. I'm going to show you two easy ways to remove kinesiology tape. So this video is basically a love letter to all of the patients that I have taped in the past, and especially in the first couple years of my career, when I did not tell them how to take their tape off. I don't know why I didn't think to include that in the instructions, but after a couple people came back to me and said, wow, this tape is really painful to take off and it's really difficult, and they feel like it's ripping their hair out or ripping, you know, if they have sensitive skin, it can rip their skin off. So yeah, if you are a clinician out there and you are using kinesiology tape, make sure that you tell your patients how to take it off too, because it's not necessarily like when you know about kinesiology tape, you're like, oh, okay, it's easy to take it off. I know what to do here, but it's not necessarily instinct for everybody. So pro tip, just tell people how to take it off before you put it on them, because we like to prepare our patients for what they are going to experience. Yeah. So to demonstrate this video, I have applied 2 strips of kinesiology tape to myself, and especially to my forearms, because that is where the most of my arm hair is, and it is the most sensitive area, so I'm suffering with you. No, but really, we're not going to suffer, because we know after this video, we are going to know how to properly remove our tape so that it doesn't hurt us and doesn't rip our skin off. So the first method that I'm going to show you is going to be like a deep pressure as you go kind of thing. So what you'll do is you'll loosen one end. It's gonna be a little hard to show this one-handed, but essentially what you're gonna do is you're gonna push down with deep pressure with one finger, and as you're pulling up the end, you're keeping that deep pressure of your finger as you slide it. So essentially you're pulling up that end of the tape as you're doing deep pressure on the skin. So that should be pretty pain-free, and you can see I'm already a pretty good chunk in. So again, keeping that one finger down. It's so hard to be one-handed. This is the only way I can show you. Sorry, you can't see it at all, it's fine. Deep pressure, rolling along as you pull the tape up. Goes a lot smoother when you have someone do this for you. Okay, so that's method 1. Second method is probably the easiest if you yourself are taking it off at home, which, you know, we're learning things as we go, so that's always good. What you want to do for that method is slowly and gently peel back the edge of the tape. P.S. side note, it always goes easier when you go in the direction of the hair rather than against the grain of the hair. Does that make sense? So follow that. And then what you want to do is you're kind of putting pressure on the skin as you separate the tape from it. So basically the key is you just don't want to like rip it like a band-aid, because that usually doesn't feel very good, especially if it's been on for a couple of days. So putting some pressure into the skin while you roll it back section by section is going to be a lot easier on you. And it's a good way to take off like a really sticky band-aid too. And you just go a little bit at a time, and that shouldn't hurt quite so bad. If you're having a really hard time getting the tape off, if it feels like it's fused to your skin, if you're somebody that has really sensitive skin, I do think sometimes it helps to get the tape a little bit wet. The key is that you should not use really hot water. Like if you're in a super hot shower, not a good idea, because heat actually activates the adhesive in the tape. So, you know, like when you have tape on, you really shouldn't be blow drying it. I've had people do that before. You shouldn't be going in a hot tub, sauna, anything like that with your tape on, because it actually makes the adhesive a little bit stronger, and it can literally rip your skin off when you're trying to remove the tape. So don't do that. No extreme heat. You can soak it with cool water. Like when I'm taking tape off, I find it's easiest to do in the shower, just because I can saturate it with lukewarm water and then peel it off. It comes off easier. You can use rubbing alcohol would work, you know, kind of soak it with like a cotton ball or something, or an alcohol pad, and then just like blot it to saturate it before you remove it. That'll help break down some of the bonds of the tape. So I hope that was helpful for you. Again, one-handed warrior here. But that's realistic, right? I mean, that's how we would take tape off on our own if we don't live with someone else or you're on your own. So just be super gentle with it, kind of roll it back as you go. And thank you guys for watching.